I was born in Wolf Point, Montana, which is a small farming and ranching community located in the northeast corner of the state, and where I've been a pharmacist over the last 10 years for the Indian Health Service. Wolf Point lies on the Fort Peck Reservation, which is home to the Assiniboine and Sioux tribes. And Wolf Point is also the largest town on the reservation with a population of about 2,600 people. The towns on the Fort Peck Reservation are tight-knit communities where everybody knows everybody. In fact, my son's current elementary school principal was my fourth grade teacher and is now my next door neighbor. I still call her Mrs. Brown because I don't have the nerve to call her by her first name. Sadly, over the last 10 years, IV drug use has become rampant in our local communities. Where it was unheard of to find a syringe laying on the street, now it's commonplace. The current drug of choice is methamphetamine because of its low cost and availability. Many good people, including friends and family, have succumbed to the grip of this devastating drug. Those that are fortunate enough to find a bed in a treatment facility will often fall back in with old friends and old habits upon their return home. We discovered we had a major problem with hepatitis C in the mid-2000s when we began screening all our prenatal patients for bloodborne pathogens. To our surprise, a lot of those screens were coming back positive for hepatitis C. This prompted IHS and tribal leadership to invite an epidemiology team to do a community study. They found that IV drug use was the major contributing factor to our newfound epidemic. We were not prepared, nor did we have the resources to combat this issue. Our clinic protocol was to send patients to a specialist in Billings, Montana, which is over 300 miles away. Now, if that's not shocking enough, the nearest Walmart is over 100 miles away. Thank goodness for Amazon Prime. So even though we were located close to the geographical center of North America, it still felt like we were on an island. Part of the Epi team's strategy to combat hepatitis C on the reservation was to try and offer treatment locally to our infected patients. Up to this point in my career, I was unaware of any patients that we had treated locally at our clinic. There was a doctor on the Epi team that was from New Mexico and was aware of this telemedicine program out of the University of New Mexico called Project ECHO. I was given the contact info for Project ECHO, and they graciously invited me to participate in their telehealth program. Initially, I was very intimidated, but those feelings soon went away. As many of you know, ECHO not only focuses on providing consultation, but also education. I really appreciated how Dr. Aurora and the team explained their treatment decisions with enthusiasm, even if it was something that we may have covered just the week before. With this type of learning environment, the knowledge soon becomes ingrained, and it wasn't long until I became our local expert on hepatitis C. What's really interesting is that we didn't just learn about hepatitis C, we learned about the management of a lot of other disease states, most notably behavioral health issues, which often accompany patients with the infection. So applying the knowledge I learned from ECHO, I began to work trying to identify our patient population. I reviewed hundreds of charts and lab results, and I definitely found some discrepancies with the ordering and interpretation of those results. So next I worked with our lab to develop order sets that were comprehensive so that when our medical providers did order hepatitis screens, we're able to get all the information necessary to make an accurate diagnosis. And lastly, I worked on educating our medical providers on how to appropriately interpret those results to ensure that our patients got the correct information. Since we discovered our problem through our prenatal clinic, a major concern was identifying the children born to the hepatitis C infected mothers. So pairing with our public health nurses, we reviewed the charts of these mothers working to try and identify the children. Once we began to identify the children, we started screening them as they came through our clinic. In all, we identified close to 200 children, and we were able to screen over 50% of those with thankfully no positive results. Now it was time to actually start treating patients. The support provided by ECHO is phenomenal. I remember one time I had a patient that had developed critical lab values. This was a few years ago, and it couldn't wait until the next telehealth clinic. It had to be addressed now. I had been given Dr. Aurora's cell phone number, so I called him and left a message explaining the situation. Now, Dr. Aurora is a busy man, but he returned my call within 30 minutes and explained to me exactly what needed to be done to help this patient. But that's how the whole team operates. His prompt response really meant a lot to me. It reinforced to me that what I was doing was really important. If he was busy then, I know he's extremely busy now, so I wonder if he actually still gives out his cell phone number. Knowing him, he probably does. Thankfully, I only had to bother him once, so I'm not sure if the number that I have is actually still in use. But there is still a lot of work to be done. It seems we're identifying new patients on a daily basis. Just last year, we averaged 10 new cases per month. Without ECHO, we really would have very little to offer these patients. Currently, I'm the only provider treating hepatitis C locally, and the workload is definitely overwhelming. But there is help on the way. Last fall, we were able to send a delegation of medical personnel to do the training with ECHO with a plan to bolster our hepatitis C services, as well as to start an ECHO rheumatology clinic. My advice to anyone who is considering starting an ECHO clinic is to believe in the process. If you're like me and maybe had doubts about your own ability and knowledge, I promise the ECHO team will provide the support necessary to make your efforts a success. Thank you.